For healthcare marketing or pharmaceutical marketers, storytelling is perhaps one of the strongest tools that they have. And the reason being is it can really, when done well, can break down stigma, it can create authenticity, and most importantly, probably, the end goal is to spark action from patients. So whether that next step is just going online, following that transition from TV to online to look at a checklist, to even seek out an appointment with a provider, perhaps to get a diagnosis. But I think that a story, when done well, can create awareness, and then the end goal of sparking action in patients and really connecting with them where they are.
So what kind of strategies will take you from connecting a TV ad to the next step in a digital action?
I think the most important thing is probably making that next step, that transition, as seamless as possible. So if there is a patient who sees an ad on TV, then making that next step as easy as possible. So being able to follow up online. Also, perhaps if it's for example, maybe it's a celebrity campaign or something like that, being able to go to a social media page and to hear more about whatever it is that is being advertised. I think that is extremely important. But the biggest thing is removing the friction, trying to make it as seamless as possible for the patient, and to allow them to move into that next step, to understand what it is they may or may not need to do next.
That transition from top to bottom funnel isn't always smooth. What sort of challenges do you see advertisers facing when they're trying to bridge that awareness and engagement approach?
There are a lot of challenges. A few of them are today, especially in today's media environment. Patients are everywhere and they're consuming media in a variety of different ways. So whether that's linear TV or YouTube or social media, whatever it may be, but it is important to connect with patients where they are, so making sure that those advertising campaigns are targeted not only to a specific population, but also making sure that they are using the type of media that those individuals are consuming. And then I think making that transition seamless, it goes back to making it more targeted for the patients, and like I said, removing that friction so that regardless of how they are engaging with that ad or seeing it for the first time, that they have clear next steps to be able to follow.
What trends do you see shaping the future of integrated TV and digital healthcare campaigns?
In the future, and one thing we're already seeing right now actually is probably going to continue moving forward, is just that authenticity that's being brought to so many different campaigns. So it's highlighting real patients, real patient voices, whether that is celebrity or not. It's bringing authenticity to those campaigns. And when patients feel connected and feel like they're being heard, not only does that create awareness, but it's more likely to spark action from those patients. So I believe moving forward it's going to be clear and consistent and all of the things that you would want in a marketing campaign, but also really trying to bring more authenticity to ensure that patients are at the center of those campaigns, and to ultimately spark action on their end as well.